Yeah, I mean, you can kind of look at them in a couple of different categories. Developmental is one where you might find that some people never quite developed good enough ocular motor, binocular visual dysfunction, binocular function skills prior to engaging in school and those sorts of things. And so you might identify there's a delay in the development of those visual skills. And so when they're placed in a situation where their skills don't match the demands, then it creates symptoms. So, a body of evidence that indicates that focusing problems and binocular vision problems can occur over time. And the expert opinion is that it's a cumulative stress from doing near work. We've got the binocular visual system is really designed for us to survive and move through a three-dimensional world. And instead, in modern life, we sit still as we are right now, looking at relatively two-dimensional things at a near distance. And so our vision's immobile, we're immobile. That's not what our visual system's designed to do. And so I use the same analogy that, we get stress and strain in other parts of our body from sitting still and not doing much. Why would the visual system be any different? And if you have the opportunity of tracking kids over time, and we've seen this in the research, but we get to do it in this practice as well. You can see kids coming in at preschool, everything's great. It's not so great at grade 2 and 3, probably more 3 and 4, because the near work demands have really increased. The volume of reading that they're doing has increased. The need to read smaller print, the need to kind of comprehend what you're doing places a lot more strain on the visual system. So you've got that vision problems develop over time from what we do with them. 80% of computer users have some sort of eye strain symptoms. And then you've got injury and illness like we're talking about. So brain injury, post-viral, those sorts of things can also result in a binocular visual dysfunction. I think it's 50% of concussions and whiplash have a form of binocular visual dysfunction afterwards.
So you talked about developmental causes. So amblyopia or lazy eyes, it's commonly called. If that's untreated, does that often lead to BVD as well?
Amblyopia and strabismus is a form of BVD. It's probably on the I don't like to use the word extreme end, but it's at the end where you've really shut down the functioning of one channel to try and maintain some sort of limited form of binocular vision. And you get a wide variety of symptoms depending on the nature of the eye turn and the amblyopia. Sometimes it goes unnoticed because the symptoms are very, very subtle in terms of, again, you avoid what you can't do. At the extreme, that people with eye turns and lazy eye, so strabismus and amblyopia, do have problems with depth judgment. There's some research to indicate the reading speed is not as good as in people who have normal binocular function. So they tend to present with different symptoms.